I'm Abou-Chebl. I'm a stroke and interventional neurologist, and I would like to talk to you about stroke. Stroke is the fourth leading cause of death in the United States and is one of the leading causes of death in the world. But some would say more important than the fact that it's the fourth leading cause of death is the fact that it's the leading cause of adult disability in the United States. Stroke is a disease that affects the brain. The brain is what makes us human. It's how we think, feel. It's everything that makes us who we are. And stroke is what happens when there is a sudden cessation of blood flow to the brain. That is, a part of the brain dies because it doesn't get enough blood flow. That happens in about 85% of the time, and we call that ischemia, ischemic stroke, or people like to say a blood clot. A blood clot went to the brain and blocked the brain artery. The other 15% of the time, stroke is caused by a rupture of an artery, leading to something called intracerebral hemorrhage, bleeding into the brain. Okay? And the treatment for stroke, whether it's ischemic or hemorrhagic, are quite different, but sometimes are also quite similar. What are the symptoms of stroke? Stroke manifests, shows itself by the sudden loss of function, neurological function, meaning sudden inability to speak or speaking with slurred speech, sudden paralysis on one side of the body or the other, sudden numbness, sudden blindness in one eye or the other, sudden double vision, sudden vertigo where the world begins to spin, associated with trouble walking, feeling like you're drunk. Sometimes a sudden severe headache can be a manifestation of stroke, and sometimes stroke can be catastrophic where a person literally drops to the ground unconscious. And there are many other more subtle symptoms of stroke. One simple way that you can remember, one simple way that you could decide if someone is having a stroke is to use something we call FAST, F-A-S-T. F stands for face. If you notice that someone has a droopy face on one side. A stands for arm. That is, when they lift their arm up, it falls to the ground, or that they have arm paralysis. S stands for speech. If someone has slurred or garbled speech or nonsense speech. And the T stands for time, reminding you to call 911 immediately. So remember that. FAST. F-A-S-T. Face, arm, speech, time. Okay? And teach everybody you know, even the children, your children, about that, because sometimes they may be the only ones who can witness a stroke, and they need to call 911. Now, let's talk a little bit about what are the risk factors for stroke. How would you know that you're at risk for stroke? As I mentioned earlier, the single most important risk factor for stroke is high blood pressure. Okay? Everyone must get their blood pressure checked regularly, and if you or your loved one has hypertension, high blood pressure, make sure you go out and buy a blood pressure machine, check your blood pressure regularly, and if it's elevated, make sure you talk to your doctor immediately, take your medications, and of course, avoid excessive salt intake, which can greatly increase the risk of high blood pressure. The most common cause of bleeding in the brain is high blood pressure. In fact, high blood pressure is the leading cause of all forms of stroke, and if, as a result of this video, I do nothing else but convince a few people to get their blood pressure under control, I will have helped far more people than anything else that I could have done. What are the other risk factors for stroke? Diabetes is a major risk factor for stroke. Obesity, high cholesterol, sedentary lifestyle, lack of activity, in other words, are also major risk factors for stroke. The important thing to realize is that stroke is treatable, and you and your loved ones and everyone you know should be aware of the signs and symptoms of stroke. And if anyone you know or you see that develops any of these symptoms, you should call 911. Time is of the essence. Stroke is treatable, but the brain is incredibly sensitive to injury, and with every passing minute, roughly 1.8 million, that's million with an M, brain cells die per minute of a stroke. And so every minute that goes by, your loved one or your friend or even yourself is losing important brain cells, important brain function, important memories. And so getting to the hospital by calling 911 is the most important thing that you can do.